My name is Lucy Reid and I am a clinical psychologist. A lot of the people that we see may be presenting with complex post-traumatic stress disorder, so that's as a result of either multiple traumas throughout life or early traumas, and that can often lead to a pattern of difficulties in relationships, difficulties managing really strong feelings. It can include trauma symptoms such as nightmares, flashbacks in relation to these events, and it can also include sometimes not very helpful ways of coping, including sometimes self-harm or self-destructive tendencies, either within relationships or towards themselves. So it's often people who've got quite long-standing difficulties, quite sort of chronic in nature and maybe quite complex compared to sort of the other parts of the service. Talking Therapies, we're a large service of many different types of therapists, and we offer different therapies in different formats and settings. Within the psychology part of the service, we're a group of psychologists, and unlike perhaps other parts of the service, we don't just offer a single strand model approach, we offer different therapies. So within psychology, we offer cognitive behavioural therapy, cognitive analytic therapy, and EMDR, amongst other therapies. And often we tend to work quite integratively, so we may use a combination of different models. And we work by developing an individualised formulation, which is almost like a story of somebody's difficulties, how they developed in the first place and what's keeping them going. And then we use that formulation to inform our intervention, what we do for the rest of therapy. You would come along and meet with your psychologist, normally on a weekly basis for 50 minutes, and together you would work together with the psychologist to hopefully develop a better understanding of your difficulties, how they developed in the first place, and what's keeping them going in the here and now. And then from that understanding, work together to decide on what you're going to work on in therapy, what aspects of your life you're going to try and maybe make changes in and improve.